We're joined in the studio this half hour by Jeremy Dowley. Jeremy is a physician assistant from Tripp Family Medicine. We should point out right here in Twin Falls, Idaho, on Fillmore Street, directly across from the main post office. In fact, Jeremy, maybe right off the top, we should point out people can go to the website or the Facebook page too and check out Tripp Family Medicine.
Yeah, we have regular postings on the Facebook page, and we're actually getting ready to update our website and give a little bit of information about all the different providers, nurses, and staff there at the clinic. So it'll be a little bit more informational pretty soon.
We want to point out, of course, we will take some of your telephone calls too as well. Jeremy is talking today about just some general wellness issues, and he was telling me so many people they have health insurance, but they really don't take advantage of it. There are those people who brag that they're 56, 57 years old and they've never been to a doctor, and I'm fit as a horse, depending, I guess, on the age of the horse. But you deal with that, I'm sure, a lot in the office.
Definitely, that's one of the things that we see often, and you know, from the clinic side, it's one of those things that we try to encourage patients to come in on a regular basis and have wellness exams done. And the thing is, if your insurance is going to pay for it, and most times it covers the copay, so there's no copay to the patient when they come in for those exams, and so they're able to get a visit and get to know their primary care provider and establish a relationship with them. So when they do get sick, they feel comfortable coming to someone who knows a little bit about their family history and their health history and things like that, so that it's not just a, you know, well, get you in, get you out in about 5 minutes, and I don't care who you are, you're just kind of a number. And that's definitely not the scenario that we want our patients to experience, because I think you can become jaded quickly about healthcare in general if those are your experiences where you feel like a number. You feel like everyone gets the same prescription, everyone gets the same treatment, and there's no personalized care.
I had a friend years ago that I worked with, and she ended up passing away from a very aggressive form of cancer, but she had looked to be the picture of health prior to that, and again a situation of just not going to the doctor very often. And I think that she had been told if she had been in 3 to 4 months earlier, that this may have been something that they could have avoided, that they could have saved her. And so I guess some of these are very dire warnings. It's not always that bad, but there is a reason to go periodically, maybe a couple of times a year, even if you don't feel that you've got an issue.
Exactly. It's kind of a funny thing because we treat things like our cars so well, right? We every 3 months we're taking them in to get the oil changed and doing tune-ups, and if we hear a weird noise, then the first thing we do is take it to, the mechanic and have them diagnose what's going on. But, heaven forbid, we'd go in and check out our own bodies and make sure that everything's going well with those, because, obviously we have to live with those for the rest of our lives. But the car, we pay on that monthly, and we want to make sure that we take care of that because it's such an investment. I mean, that's kind of our mentality. It's funny, really, if you think about it that way. These machines that inevitably are going to be unusable, they don't last a lifetime. That we treat them so well, but we sometimes we neglect our own bodies that we have to use for our entire life.
I was going to say there are so many people who come in that you can determine factors, I guess, in their lives, and if sometimes it's just a minor adjustment they have to make in lifestyle, and they'll be fine, right?
Oh yeah, things like, for instance, I had a patient come in to see me who I would say is the model of health in many ways, very active, gentleman in his 50s, and hadn't been in to see anyone for years and years. And, he's like, I never get sick. There's no reason for me to come in. Came in, his blood pressure was extremely high. I mean, we're talking high 160s for the top number, up to the hundreds for the bottom number. And, you know, it definitely puts him in a risk category for things like strokes and heart attacks, having that high of blood pressure. Well, we talked about some lifestyle modifications that he could make. He really started to watch his sodium intake, which is a huge factor with blood pressure. And after a few weeks of working with that, and him being really faithful in reading labels and watching his sodium intake, his blood pressure normalized. And I'd seen him, every time that I'd seen him previous, it it had gone down just a little bit more and more and more as he watched his sodium intake until, it was in the 120s. And I would say that's a rare case, but, he didn't feel bad. He didn't feel sick. And that's kind of the way it goes with a lot of these diseases is, there's not really any sentinel um, for us to know that we're getting sick.
For people who are tuning in this morning, I just want to remind you you're listening to Better Health from Tripp Family Medicine. Jeremy Daly, physician assistant, joining us this morning on air. We've got about 20 minutes left, and following the break, if you have a question or comment, an issue perhaps of your own that you think might need to be addressed, if you touch base with Jeremy and maybe even need to find a new office, he might be able to hook you up and tell you how you can go about making an appointment and becoming a patient of Tripp Family Medicine as well. We'll get to that in just a few minutes. In the meantime, it's 36. And you're listening to Top Story as well with Bill Colley on News Radio 1310 KLIX and newsradio1310.com. Jeremy Daly joining us in studio. He's a physician assistant from Tripp Family Medicine right here in Twin Falls. Of course, Tripp Family Medicine is located on Fillmore Street directly across from the main post office. And Jeremy is just talking some issues today about, well, I guess we could say even stubborn people who they don't like to go to the doctor. They feel it's an imposition, and why should I go if I don't feel that I have, if I don't have the flu, I don't have a cold, I don't have a backache, there's no reason to go. And your argument is probably not really the best reasons.
Probably not. And, I think there's a lot of people that have the mentality, but I think there's a lot of people that also think, there's no reason for me to go. What are they going to do for me? What kind of service can they provide for me? Because really, I mean, that's what we're doing. We're providing a service for them that they couldn't do for themselves. And so, for them to not really have any good motivation to go in if they feel like they're healthy, they eat well, they exercise, they take care of themselves, what would be the motivation? Well, I think that's a great question. And, my the answer to that would be, sometimes people take really good care of themselves and due to family history, due to, just the genetic makeup that that individual has, exposure that they've had in the past, things that sometimes are out of their control, they still develop serious diseases like diabetes and high blood pressure and high cholesterol. And there's genetic diseases that happen all the time. Things like um, rheumatoid arthritis and these diseases that really are um, autoimmune that they don't do anything about. And really, we can help those patients because um, we can get ahead of the curve, I guess you could say, rather than them coming in late in the game where they're experiencing these big issues due to the disease. We can get ahead of it and prevent a lot of these things from happening.
You mentioned that a lot of people out there, because their pain threshold may be different than someone else's, they may have an issue like that with arthritis, or they may have another issue, but, they just think, well, pain is part of life and I'll go about living that way. And I have a sister who has a bad knee, and she's a school teacher, and her insurance is obviously better than mine. And I keep telling her, "How come you haven't had that knee worked on yet?" And it just doesn't seem to, she she just seems to think I'll keep walking around on it and I'll be fine because life has its moments of pain. But it doesn't have to, right?
No, I don't think so. I think, that our business is really to make people's quality of lives better. I mean, ultimately, when you look at what the healthcare industry does, that's what we should be doing is in improving the quality of life. Um, sometimes we do it by um, giving medicines that prevent diseases that would cause them to have strokes and heart attacks or from having cancer. And all those things definitely affect your overall quality of life. Having serious joint problems, there's amazing therapies, whether it be something like injections or um, ultrasound, and there's all sorts of therapies that we can do that are non-invasive that sometimes will help joint pains and aches. And people don't like to talk about surgery, but sometimes that improves people's quality of life drastically.
We have a caller with us. And caller, you're on the air on Better Health with Tripp Family Medicine with Jeremy Daly. Go ahead.
Jeremy, I have two deals. One, um, with your practice, because of the doctor and EPAs and everything else. Are you guys running it more like a HMO where when you come in, you just never know who you're going to see?
That's not how we run it. We like our patients to be able to see who they like to see. Um, that doesn't mean that, for instance, if you want a same day appointment, that you're always going to be able to see who you want to see. We all keep same day appointments available, but we definitely like our patients to feel comfortable with whatever provider they choose. And so there's some patients that just want to see Dr. Tripp, and so we schedule them with Dr. Tripp.
Okay, that's what I wanted to know because I'm kind of looking for a doctor.
Okay.
Um, the second deal is you've made a lot of car analogies, and I'm a 40-year mechanic. And there's one thing I've always told people. They always say, "What's the reliability? Is it ever going to break down?" The number one thing any mechanic will tell you is it's not if it will break down, it's when and how bad.
I like it. No, I think that's true, and I think the same goes for us as people. You know, sometimes our threshold for breaking down, so to speak, is a little bit greater than other people's, and so we can go a little bit longer, and we can, basically wear ourselves out a little bit more, and then, eventually we'll break down. So I think that's a great analogy. Thank you so much.
And of course, again, you don't always see it. You could look at a vehicle and go, "Wow, that looks really sharp," but you don't know what's going on under the hood or in the undercarriage. And I remember one time I hit a huge pothole on a bridge in Pennsylvania, and I had 39,000 miles on a vehicle, and I took it in to get a little work done on it. Otherwise, and somebody said, your ball joint's gone. And I related it to hitting that pothole, but I would not have known that if I didn't have to go in for service anytime soon. So by going in for the service, they found the bigger problem, and that's the whole point here is that a little service, maybe a physical now and then, is going to pick some of these things up.
Certainly, and one thing that I always tell patients is, there may be nothing wrong with your labs or there may be nothing wrong with your exam, but we'd like to follow you over time. And if we start to see trends that maybe, let's say, we start to see elevation in your liver enzymes and we don't see anything else going on, well, we can say, well, maybe you're developing fatty liver. Maybe they're still within normal limits based on the labs that we have, but everyone's normal is different. We have ranges that are acceptable ranges based on, statistical analysis of all this, health data, and so we use those as kind of a, well, this is where you're at based on where, 98.5% of people are, and there's some people that are normally outliers. They have elevated labs, and so we can monitor those things over time, and if it's something that we see a change or an elevation in a lab, we can take care of it early on. Um, One example is, we like to keep a close eye on kidney function in patients over time, and you know really what we're trying to do is prevent them from doing things to their body that would make their kidney function worsen. So, there's a lot of times patients come in and they have joint aches and pains, and we'll check their kidney function and it will be decreased. And after getting a history from them and talking about things like, well, do you take a lot of non-steroidal medications like ibuprofen and Aleve? These medications are good, but they can reduce blood flow to the kidneys temporarily. And so, we can say, well, let's cut that out. Let's keep your kidneys from losing any more function. And those are simple things that in most people you wouldn't say, well, don't take those over-the-counter medications.
I remember going to see the doctor a few years ago, and I'm a textbook case, a man in my early 50s, and I've got to lose weight. But they were stunned how low my cholesterol was. On the other hand, some people can walk in and they look great, and they may even be eating well, and that's another alarm because I know people who've gone in and discovered they had a cholesterol level that was in the stratosphere. They had no idea. They'd been walking around for years that way.
Yeah, exactly. I think we sometimes equate thinness to health, and to some extent there's data that supports that, but there's a lot of people that say, well, I'm one of those people that can eat whatever I want and I don't gain weight. Well, It you may not gain weight, but it's probably affecting the way that your cholesterol and your blood pressure and even developing things like diabetes. I've seen a lot of people, my experience in El Paso, I saw a lot of people who looked like they were healthy and they were severely diabetic, had to be on insulin right away because they were so diabetic.
Right. And I had a friend, I think he ran 6 miles a day and discovered he was a diabetic at about 60 and had no idea up to that point. And the running and eating well and nothing seemed to, but that's where it becomes, I guess, more genetic than likely lifestyle.
Yeah, it certainly could be. And, you know, it sometimes if like the pancreas, the organ that produces insulin is damaged for whatever reason, yeah, you can develop diabetes and you a lot of times don't know until you get really, really sick.
For people when they do come in, is blood pressure usually though the biggest one that you come across that they don't know about?
I would say so, because I think most people are surprised to hear that there's really no symptoms when their blood pressure is high. Low blood pressure, a lot of times we see dizziness, lightheadedness, symptoms like that. But with high blood pressure, there's really nothing for the most part that lets you know that something's off. Sometimes after we treat people, they'll say, you know what, I feel a lot different and I notice the difference when my blood pressure's lower. But they would have, you know, they're the type of people that would have said, well, I don't feel sick. And so, in my experience in the emergency room is people come in having a stroke or a heart attack with extremely elevated blood pressures and getting a history from them, you'll say, are you hypertensive? Is your blood pressure elevated? Typically, and they'll say no. You'll say, well, when's the last time you checked it? Oh, it's been about 20 years. And so that's one of the scenarios that we want to prevent. We don't want you to be going to the emergency room, having a stroke or a heart attack, saying, well, I don't have high blood pressure.
And probably that blood pressure cuff at the store is not nearly as perhaps reliable as going to the doctor and having it done.
Yeah, a lot of the automated blood pressures, there will be um, maybe small discrepancies depending on where they're taken on the wrist or the ankle. Those are usually less reliable. But, a lot of times what we'll tell patients is bring your blood pressure cuff into the clinic. Let's compare it to what we have. And then we can say, well, yours runs about 10 points higher than ours. So, as you take your blood pressure, keep that in mind.
And I had a nurse friend who kept a blood pressure cuff around the house, and so I don't know. I guess because she felt she wanted to take people's blood pressure in the family and the like. But again, not all of those are probably as accurate as some you might find in the office.
Yeah, certainly. And if we have any questions about blood pressures, sometimes we'll use automated cuffs, but we all do manual blood pressure, so to speak, using a stethoscope and kind of the traditional way. But that's if someone comes in, they're elevated. A lot of times, I'll check it 2 or 3 different ways just to make sure that it is indeed elevated, and we don't want to talk about starting blood pressure medication or things like that if there's not truly high blood pressure.
We've got about a minute left. Is there anything we didn't mention that we should bring up to people too on this subject?
I think one of the things that I like to talk to patients about is, you know, it's important to have a medical home. It's important to find somewhere that, you can go for things like wellness exams, but also when you're sick and, to feel like you can go to someone you trust, someone who is going to be able to look at your family history and your past visits and really come up with a better diagnosis than just in and out kind of um, urgent care type visit, which they it definitely has their place in the healthcare system. But if you can help it, find a primary care physician or PA, NP who can take care of you and give you the service that you need. And you know the great thing about our clinic, I feel like, is we can take care of pretty much every need that patients have. And if we can't, then we talk to specialists and we coordinate care with them. I talk to specialists a lot about my patients and make sure that they're getting the best care that they can. So that's something I think to think about.
We also need to point out very quickly too, if anyone, because you are looking for new patients, if anyone has an interest, the telephone number at Tripp Family Medicine.
933-4400.
And again, this is an office, too, that will not make you wait 3 weeks for an appointment if you have a need. I wanted to point that out, too, this morning. Jeremy, thank you for coming by.
Thanks, Bill.
We'll see you again in a few weeks. It's 8:58. We've got news coming up from the Fox Radio Network in just a moment. One more hour of the program ahead. We'll review a little bit of some of the results again from yesterday. Of course, caucus in Idaho for Democrats and the caucus in Utah for both parties, as well as the primary in Arizona. Details on the way on News Radio 1310 KLIX and newsradio1310.com.